Upper back myofascial release. Taking a lacrosse ball, we're going to work the area in between your shoulder blades where your rhomboids and pieces of your middle and lower trapezius muscles hang out. Take that ball and put it in between the shoulder blade and your spine. When you roll the spots, you'll feel areas of discomfort. Focus on spots where the tension is large and you can feel the discomfort radiating through your body. A couple rules here is just make sure you're not pressing directly on the shoulder blade or that you're pressing directly on the spine. When we roll or self-massage, in general, we never want to hit bones. You can also do this on a wall for a little bit more control. If you have an open wall, your legs can be as bent as mine or a little further up. It takes a little bit of getting used to figure out how to move the ball without it flying all over the place. The other option is the side that you're rolling, make sure to push that elbow across your body to open the upper back even more. And now we'll switch sides, working into the other spot, remembering that one side might be very different than the other, and considering the same things just mentioned. Don't roll into the bones, make sure you can breathe as you're doing it, and feel free to pin and stretch that arm as you go back and forth. Myofacial release for the lower back. We're going to take the lacrosse ball or the massage ball and massage the area underneath your rib cage and above your hips. This is the area where a bunch of different connective tissue for your back exists, but specifically working into a muscle called your quadratus lumborum. It's a muscle that helps you lean side to side, and it often gets sore very easily. So you're moving the ball on one side of your spine, rolling up and down, again avoiding bones, and just working into that soft area of the spine. You might feel a very hard bump or an area where you feel it radiate across your back, and that's the place where you want to pause, maybe do a few deep breaths, and slightly roll just a little bit smaller. You can also do this on the wall for a little bit more control or a little less pressure if on the floor feels like a bit too much. Just remember, you don't want to put so much pressure on that you can't breathe. And then we'll go to the other side. One side is often tighter than the other. And this is why even if one side is very tight and you work on that side, make sure to work on the other because your brain works in pairs. And if one side's a little more released, it can help your nervous system calm down the other side. Myofacial release for the feet or the plantar fascia. Between your 2 feet, you almost have a quarter of your bones in your body built into these sensitive structures. So taking a ball or a stick, take your foot on top of it, and you can start by pushing your heel into the ground and rolling into the ball of the foot. You can hold on to a wall or something on the side like a chair to make sure you don't fall over. If you pin your heel to the ground, it should be easier to feel a little bit more pressure through the upper back and you don't lose the ball like I just did. Though it's fine to lift the heel up and roll back and forth and then pause, dropping the heel onto a piece where you feel a lot of tension. For me in particular, I get this a little more on the arch of my foot, Some people might feel this more in the heel or the ball of their foot, depending on how they move. Spend a little time working back and forth, making sure you're breathing. The goal here is to just stimulate the tissue, not necessarily to remove the knots, but just let your nervous system know it's there and know that it's safe. Now we'll switch legs, remembering that one foot can often be way tighter than the other, so just approach it first with a little bit of curiosity and don't expect it to be exactly the same as the other leg.